All right, good morning, everybody. So today we're going to talk about needs assessments and how you can use data contours to help with your next needs assessment. So we'll talk specifically about an analysis framework and kind of an approach for doing a needs assessment, but obviously there are a lot of different use cases within that. And so we'll talk about sort of how you can use the tools and data within DataContours, both specifically for something like a community health needs assessment, but also more generally as you're looking to analyze and understand your community, how DataContours can help with that. All right, so before we dive in, a little bit of housekeeping. So for those of you that are new, welcome. For those of you that are returning, have seen some of previous webinars, welcome back. So this is a one-way webinar. You can hear me, but I can't hear you. So the best way to ask questions or provide feedback is using the chat or the questions tab on the sidebar there. So feel free, as we're going through, if you have specific questions, to go ahead and put those in there. And I'll pause kind of as we go along to try and answer that. So very much on this one, want to be able to answer any questions you have, either about general approach or data or indicators, or specifically about the tools that we'll show. This is one of a series. This one is obviously more focused on kind of data contours. We've done a lot around, overall approaches to needs assessments, about COVID, about sort of community needs and what the latest data is telling us. So, I certainly enjoy doing these webinars and love feedback on topics that would be interesting or relevant or useful to you all. And then, because it comes up every time, a link will go out after this immediately from the service we use to a recording. So you can access a recording of this webinar. You'll also receive a follow-up email from me later today with a link to the webinar recording on YouTube, and then also the slides that you can access. Feel free to share, if any of this content is relevant to anybody. Feel free to pass it along. A note, we'll also do a version of this same webinar next week, next Thursday at the same time. So if anybody missed today and would like to get a second chance, we'll do this. We'll be here in a week. Okay, and a quick, some of you are familiar, some of you are new. So just a quick overview on DataContours. We're a data technology company focused on community and population data. So we've been doing this work for a long time, about 10 years, working with large health systems. And DataContours we started about 6 months ago as a new product and solution company focused on data and assessment for communities. So we've been working on these tools and these approaches to doing needs assessments for a long time. And this is kind of the latest iteration of the state of the art that we're really excited about. So for today, the topics, we're going to try to answer 4 questions. So first one is, what makes a great needs assessment? Talk about some general kind of questions you're going to want to answer. We'll provide a framework for how to think about your analysis, how you can structure your report, what might be most useful. Talk about kind of the capabilities of DataContours. And again, we really built this with needs assessments in mind. So we'll provide a kind of a walkthrough of how you can use the features of DataContours to map to the best practices around needs assessments. Talk about specifically what kind of data we can help with, and then some cool features that will help support the analysis directly. All right, so before we dive in to the tool, let's talk about needs assessments. I think we have a range of folks on here with different experience. If this is your first time tackling a needs assessment, or if you've done this for years, or you've done a few different either community health assessments or like a community health needs assessments, even if you've done more on the implementation planning side, we find it's all kind of the same type of analysis that people want to do. And ultimately, your goal is to support decision making. And so, oops. All right. So within that decision making, there's four big questions that you're trying to support and trying to answer. So, what is the current state of X within my community? If you're doing a community health needs assessment, obviously you're looking more at health outcomes, social determinants. If you're doing, say, a COVID impact analysis, you're looking at maybe some economic indicators as well. Really, a whole broad range of things you might be looking at, but you're interested in where are things today. And that can actually be a much tougher problem to question to answer than maybe people think. And then you'll want to talk or answer the question: what are the historical trends? So, how are things getting better or worse, and how and where? What's likely to happen if nothing changes, and what's likely to happen if we take action. And one of our big takeaways from doing these kinds of assessments for years and years is the most successful needs assessments are those that really directly inform strategic planning. And so I think a lot of folks within a needs assessment want to be pretty risk averse and just answer the first question: what's the current state? Maybe get into some of the historical trends. But really not dive into what are the implications of action. And we really encourage people to think broadly about their needs assessment. If you were on one of the webinars we did this summer about kind of what a needs assessment looks like in a post-COVID world, it's incredibly important right now for decision makers to have some data. Even some data is better than nothing about the state of the problem within their community, where things are likely to go under different scenarios, both with COVID, but also with the medium-term economic impacts that we're seeing within communities. So an easy way to kind of summarize is your needs assessment should talk about past, present, and future. And the more you can tailor the past, present, and future analysis to inform the questions and needs of decision makers, the more likely your needs assessment is going to be successful. And so, yeah, I mean, we'll talk about that point quite a bit. But even if you're just doing it, CHNA, for example, as part of a regulatory requirement, and there's a huge opportunity to think more broadly about how your needs assessment can be more than just a one and done every 3 years, data report. So there's typically four types of analysis or four ways of looking at the data that you'll want to think about. And I'll start now with the big picture takeaways. We say this a lot. Data in of itself as just a number is meaningless. It's context that makes it helpful. And that context, especially for people outside of the data analysis world, that context is not always explicit. So when we talk about things like poverty rate, or we talk about things like educational attainment or food insecurity, for folks who are steeped in this world, there's a lot of context that's implicit within each of those. We know what the high and low bounds are. We know what an average number is that's good for poverty rate or that's bad for poverty rate. We typically know, without having to say it, that poverty is generally has been getting better in communities over the last 5 years rather than worse. And it's all that context that really makes the number of 14% actionable for folks. And so as you're thinking about your analysis, the key part of that analysis is making these implicit contextual pieces of information explicit so that people can really understand what the meaning of the data is. And it really comes down to these simple questions that you want to ask and be able to answer. The first one that's pretty obvious is, how are things changing? Are they getting better or worse? And are they doing that over time? Are they doing that within a geographic region? Are they doing it, you think of geography and time as months, years, or, tracks, zip codes. So there's all sorts of different, what we would call granularity questions, or aspects to that question. But this is really, time and space are kind of the two things that everybody is obviously really familiar with, and is probably the key way that you'll want to contextualize the data, which is why, a chart and a map, respectively, are so effective for folks at communicating data. So another way, especially within community and population health, you'll want to look at information and data is how do groups of people compare? And this is another really important contextual piece of information, especially, today, where with what we've seen over the last 6 months, the conversation around inequality and disparities in health and education and economic outcomes amongst different populations, and especially looking at minority populations and vulnerable populations, underserved populations, really understanding how they differ from the total, from the average, is a really important part of your analysis, and being able to dive into what those subgroups look like, and understand and be able to talk about kind of where there are differences and what the potential sort of causal reasons behind those differences are is a really valuable part of the analysis. And then, high level summary, we think about, is this good or bad? And there's a lot of different ways to think about good or bad. Obviously, for things like, food insecurity or other kind of basic needs, the worse they are, the worse they are, right? So if there's more people in poverty, that's bad. But one of the key things people ask about is to what degree of bad. And so you want to think about how to do that. And we've got a couple of approaches that we'll talk about. One is just how do you compare to an average? The other is using something like a Z-score or a percentile ranking. So are we in the 99th percentile or the first percentile? It'd be a really helpful way of not just saying it's good or bad, but how much of a priority is this particular need for the type of intervention or strategic planning or whatever our action is. Because ultimately, I guess the key takeaway that you're all probably very intimately familiar with is, so many of these needs assessments right now, 10 years ago, it was hard to get data. Now it's the opposite problem. There's so much data, and it's really hard to choose what are the things that we're going to look at. And so some of these sort of meta analyses on top of the data, being able to say, what's the worst bad thing and what's not, is a really important part of filtering through the information to come up with those things that are both priorities, but also are actionable for your organization or your community. So as we think about the current state in detail, you want to think about, are things good or bad? So if we're talking about where things are today, and then what are the variances between these populations today? How does the current state that we see, a particular indicator within our community compare to others, like the national benchmark? And generally, as you're thinking about current state, talking about why it matters rather than what it is a good rule of thumb. So if poverty, for example, is particularly bad between, or we see a disparity between poverty rates within populations, the disparity itself is interesting, but what's more meaningful is what are the implications of that disparity in things like health outcomes, or things like educational opportunities or economic opportunities. So these are all kind of starting places to more of that analysis and that conversation about why it matters. So as you're thinking about looking at historical trends, the big question is, are things getting better or worse, and do we know why? One of the big challenges in this space and working with this amount of data is sometimes things are clear, sometimes they're not. Sometimes we see strong relationships between indicators that we would expect to see, like income and poverty. As income goes up, poverty goes down. Other times we don't see those relationships. We just did an analysis with a community that had a number of tribes within their population, and there was a really interesting disconnect between overall incomes going up, but poverty rates also going up. And that's an interesting element that sort of raises some questions for the analysis of, do we know why we see these unusual relationships between indicators, and can that tell us something that's important for us as we think about decision making? Within another way that's really useful to think about historical trends is, are we seeing individual measures going in certain directions, or increasingly are we seeing groups of measures? Are we seeing sort of categories of data move in similar directions? So an interesting one here would be, something around health behaviors, for example. Are we seeing more people generally doing better or having healthier behaviors, or are we seeing only movement within one or two of these areas? So, more access to care. However, people aren't actually going to see the dentist at the same rate they're going to see the doctor, for example. So that what we would call a framework, a group of indicators, can be a really helpful way of synthesizing, again, hundreds of data points in a way that will make sense for folks. And then doing a population breakdown, are you seeing the same movement over time? Are things getting better or worse for all populations, or just some or none? And then also a geographic component. Where are things getting worse? Are impacts localized, or are they general? And this is a really interesting one, especially when you're looking at city or county data. Are you able to see some of these things like gentrification impacting some of the health outcomes or some of the determinants of health in a way that may shift your strategic planning? So, for example, if you're focused in a particular area of a city for the last 5 years, but because of gentrification, the population that needs services has moved, that's a really important thing to understand, because the top line number may look like it's getting better, but in fact, that's just because the population has moved away. Last thing, and we'll talk about some of our tools, because this is where a lot of our work has been going, is into projections. So this kind of, what's the future state, what's likely to happen, what's the worst case, what's the best case, and how do we use that to inform strategic planning and decision making? And I think ultimately this boils down to what happens if we respond and what happens if we don't. And these are kind of two sides of the same coin, but being able to say, here's the potential benefit of our action, I think is really important. But conversely, being able to say, here's the cost of no action, is equally important. And in some cases, maybe more important, especially in the circumstances we find ourselves today, where there is so much uncertainty. And as we're seeing with some of the federal stimulus, inaction is actually much more significant, and has a much more significant downside risk than action. And so we want to be able to look at what's the potential cost of inaction on our communities and on some of these indicators that we're interested in. Top level, key to any analysis is making the data understandable and actionable. Again, this is what makes a needs assessment relevant and useful. And the more that you can do this, the better. This is also, we always say it's kind of like yoga. It's a practice, right? The most effective needs assessments are actually processes rather than outputs. There's something that you do on an ongoing basis. And within your organization, and for those of you that have been on our other webinars, sounds like a broken record, but thinking about these needs assessments as ways to norm your organization to using data to make decisions on a much more regular basis is the biggest challenge and also the biggest opportunity. All right, so we'll shift into kind of some of the tool here. How can DataContours help? We do a lot, but for the purposes of this, the tool that we'll walk through, the tools, I should say, that we'll walk through the platform, does a couple of things. So first, it's got, I think we're up to about 150 indicators all in one place, which is super helpful. One of the biggest challenges we hear from folks is, where do I source the data? How do I get it into a standard format that I can use? So we've tackled all of that. The other thing, we've also added different tools for this different types of analysis. Our goal is, take what large health systems and public health departments who have, hundreds of thousands of dollars to put into these kinds of assessments through consultant time and analysts, try and automate as much of that as we can so that that same analysis is available to everybody. And be able to do that at both a high level as well as support the deep dive. And we kind of think of this as the exploration use case and the monitor use case. Give me the big picture frequently and let me dive in and ask questions of the data when I need to go deep like that. We also have projections and estimates. This is some of our newest features are around scenario projections within communities, as well as estimates for poverty and unemployment and other key measures. And then we've got maps, visualizations, data, ways that you can package this up and contextualize it for folks so that it's engaging and understandable. Okay, so let's talk about using DataContours. So for today, we're going to do an example, which would be how would we think about an analysis for Portland, Oregon. This is where we're actually based, so we're pretty familiar with the community. We want to answer the key questions that we just talked through. What's the current state? How is it changing? What is likely to happen? And the goal would be preparing a report. And this can take a lot of forms. It can be a document, it can be a website, it can be a lot of different things. But we want to support that report with data and visuals. What we'll talk about today is the kind of the professional tier of DataContours. Hopefully you all are familiar with the tool or have signed up. There's a free version. The only limitations on the free version is the amount of data that you have access to. The paid tiers, we have a community and a professional tier, just provide more access to data and then access to different subpopulations under each of these indicators. So we'll walk through the professional level and kind of what's in there, just to give you a sense. But again, the same features that we'll talk through are available to everybody. Okay, so when you log into DataContours, or if you've signed up, you will have picked an area or a location, and this is the place that you want to look at. Typically when you're doing a needs assessment, one of the things that can be really helpful as you're getting started is choosing a couple of other areas or locations that are similar that you want to provide comparisons to. And this can look like a couple of different things. Here we've got Portland, which is what we'll be spending a majority of our time on, but we also have Multnomah County, which is the surrounding county for Portland. We also created a region that is the 4 counties and sort of the metro area. So this is the city proper, but this is the larger metro area. Portland's got about 620,000 people. Metro area is about 2 million. We could also choose, say if we were interested, Cincinnati or another comparably sized city elsewhere in the country, that would help us provide some of that context of how does Portland compare. As you sign in, and again, you can, for the different levels, you can choose different areas. You can also custom areas. So if you have zip codes or a set of counties that you're interested in that aren't kind of the standard census geographies, you can actually create your own to define it. And then we'll run all the analysis and all the data behind the scenes. So whether you want to look at a zip code or a neighborhood or whatever your definition, we'll generate estimates for all of the data within the system. So as you go ahead. The key place to start as you're thinking about a needs assessment is sort of the 50,000 foot level. And so we like to start with the indicator comparison, because this gives you a high level view of all of the indicators in the platform for a particular location that you've specified. So here we've got Portland, and you'll see we've got the indicators organized by category, and these are roughly the mapping to a framework called the 7 Vital Conditions for Community Health and Well-Being. This is one we really like. There's a lot of resources out there for those of you that are familiar with Community Commons. They've got a lot of great stuff on there about the 7 vital conditions. It's a really good way to kind of organize these hundreds of indicators in categories that make sense for folks. The couple of things that we've added in here, you can see, so this is basic needs, civic engagement, education, employment, food, housing, and then we've added in some particular categories around health behaviors and health outcomes, especially for health systems and community health departments that are focused more on a health needs assessments. These health outcomes and health behaviors are pretty key. And then we've got a section on mental health and substance use, people, transportation, and work and wealth. We're continuing to add new indicators here each week as we are finding new sources and loading new data or coming up with new estimates. So this list does change fairly often. So when you're using it, the things that we provide are value. What's the national average? What's the percentile? And how has this been changing over time? And you can sort on these columns. So value, as we talked about, in of itself, really not that useful for folks. Is no health insurance at 11.3% good or bad? Who knows? We provide the national average as a way to help contextualize that. And then we also do a percentile analysis. So we say, of all of the communities in the United States, where does this particular community fall on the indicators that are comparable? So we say for children in poverty, for example, the national average is 21%. So Portland's actually doing better than the national average, which is why it's up around the 80th percentile, and higher percentile being better, 100th percentile being the best, first percentile being the worst. So right away, an easy way to start to filter out which needs or which indicators are a priority within our community. So we can actually sort this column and sort the tables to show where is the percentile highest. So which communities are doing, which indicators are we doing the best in? So children in poverty, for example, or we can go the other direction and say, show us where we're doing the worst. So violent crime rate or receipt of public assistance. And this will sort the entire table. A couple of other cool things that we're able to do here is where we have demographic information, you can drill down and see what the subpopulation data is. So for example, that's a good one here. For disabilities or population with disability, we can see what the total is, but we can see the breakout version of which of these specific disabilities, what's the percentage, what's the percentile, same rankings, is it changing over time? This is a helpful way to start that big picture. What's the current state? What are we dealing with? Typically, as you're beginning a needs assessment, you probably already have some organizational priorities. You've already figured out general directions or maybe categories that you want to focus on. Or maybe not. So this can be both helpful if you kind of already know where to start looking, but want to see some of the things you may not know, or if you're really just starting from scratch and want to see, big picture, where does our community fall? Okay, so within each one of these, there's this little icon. You can either click on the link or you can hit the search icon to drop you into the Data Explorer. And so this is this is really for kind of doing that deep dive. I've seen a particular indicator. I'm interested in learning more about some of these other questions. How does it vary over time? How is it changing? How does it vary spatially? So within this interface, actually, before I dive in there, let's talk a little bit about data and methods. So what we do in order to generate this data, because we use a bunch of different sources that are reported at a lot of different geographies. So some of it is at the tract level, some of it is at the county level, some of it is at zip code level. This is one of the big challenges with doing these needs assessments, is bringing data from disparate sources together in a way that's comparable, and just dealing with all the munging that has to happen to standardize the format and put it on a map and all that kind of stuff. So what we do is we use a really complex set of algorithms, and why we have to do all the data processing when you select an area is to work up and down using some different methods to create area level estimates for these particular indicators. So for poverty, like this one that's reported at the tract level, we use a population weighted small area estimation algorithm using a grid to come up with the value for Portland. So we have methods documents available on the website if you want to dive into the nitty gritty details, but ultimately, this is a set of algorithms and methods developed by the CDC and by NASA for processing large geospatial and population data sets. So the other direction we go is if we want to go from, say, a higher granularity like a county to estimate for a geography, we'll use a multi-level regression model to find for the indicator where there are independent variables that it's there's strong relationships with, determine what the estimates are based on the kind of local surrounding counties, the state, and national, and that's the multi-level part of the estimation algorithm. So generally, again, that's a methodology that's been developed by CDC and has a lot of published research around it. So really, what we've done is just taken those evidence-based proven algorithms and implemented the technology and scaling to be able to do it much more quickly and much more dynamically for these different regions. So that said, we're looking at poverty here in Portland. Give you a quick walkthrough. So we've got the top line number. So this is the estimate for the entire city. So 14.7%. We've got a chart that shows how it's changing over time. So it's been getting better like most places in the country. We saw poverty rate increase after the Great Recession, and then it's been decreasing for the last 5 years. We also provide a dynamic zip code level breakdown of where poverty is highest, 27, 24, 23%. You can filter this. Depending on what you're looking at, this will change to be tract level. If you go zoom in, it will change to be county level. And then over here, we've got on the left, the navigation. So you can select different areas. For us, we can select Portland, the region, or Multnomah County. You can also browse the individual indicators. So all the indicators that you see on this table, you can also access. And where we have population level data below, you can access the subpopulation data too. Couple of new features that we're pretty excited about that'll be rolling out to everybody later today are some new mapping tools. So this is the 3D interface everybody's familiar with. So we actually started with this 3D interface when we started DataContours, because the idea was, how do you make stuff engaging and interesting to folks? And one of the big challenges is within mapping, for people who don't want to get into the details, how do you get something that sucks them in? And this 3D visualization we've been playing around with for years. And it turns out it's a really compelling way to get folks interested in what it is you're talking about. It does a couple of things. It does one thing really well, which is it shows the relative difference between values particularly well, because we have this height dimension. So it's not just color, red is worse or higher value, blue is lower value. But you get the height in it, which is a really nice way of showing relative scale, sometimes that you don't get with a color visualization alone. We also now, though, have added, because people find a lot of value in this, the 2D map, which is a more kind of traditional choropleth style. So you can see for the zip codes as they map over here, we have each of the zip codes displayed on the map. So this can be really helpful too in showing kind of the more traditional boundaries that people are familiar with or are planning. But we find both the 3D map and the 2D map to be really helpful complements to each other, depending on which audience you're trying to engage with. This sometimes can be much more useful for the general public or people who, sort of want the big picture, whereas the map can be a really helpful deep dive for people who want to, see all the details and all the boundaries. We also have a new print feature. So on any of the maps, now you can hit the print button and it will download exactly the map with the legend. So this makes it really easy to drop into reports. As you're using the data and the analysis tools now, you can also get all the visualizations. Some other interesting features when you're looking at change over time, we mentioned kind of the gentrification example. So we have all of the time series data, and there's a cool slider over here that you can use to peek through and see. You can even animate if you hit the play button. It'll run through and show you how the poverty value is changing over time. And so we can see if we do that, there's actually a really interesting story to tell, which is 10 years ago, poverty rate was about the same, but it was much more generalized within the region. When we look today, we have a couple of hotspots where poverty has gotten significantly worse, even though overall it's gotten better within the region. Again, these sort of change over time and change in geography stories, and being able to demonstrate kind of where you're seeing hotspots emerge or disappear can be really helpful, and really engaging in trying to tell that story and that sort of what do we do going forward? Where do we need to focus or refocus our planning efforts? The other thing I wanted to show on this screen is we have a couple of different ways of looking at the data. So this is the value view, which is just the straight, what's the poverty rate? We also have a couple of different views, which are what's the percentile view? So if I wanted to see what the view of the data based on these national percentiles are, red being worse, blue being better, we can see where parts of the community are scoring particularly below the benchmark or particularly above the benchmark. Similarly, we have a change over time view where we can see how the values are changing over time. And so where are they getting significantly worse and where are they getting significantly better? So this hotspot region up in North Portland has been getting significantly worse while the rest of the city has been getting better. So again, different types of analysis techniques, different ways of viewing the data, but this Explorer screen is really about that deep dive, being able to go down and say, what's the story for this particular indicator within our community? Okay, so I'll pause here. Quick question: what about smaller communities? Cities of 80K or less, where census tracts aren't granular enough? Yeah, it's a great question. There's a couple of aspects to that. We actually do sub-tract estimation. So we're not relying on the census tracts, especially for our mapping. Each one of these different pixels here represents an estimation cell that we use. So we find even for smaller communities, we're currently doing a project with 3 zip codes in Southern California, we are still, we can still provide pretty accurate estimates down below the tract level. That's part of the advantage of this gridded estimation technique, is it lets us get to some of the features that may not be visible or aggregated up, especially when you get to more rural populations. That said, it's always a challenge, and we always want to be particularly careful saying these are estimates rather than actual values, because they are they're derived rather than measured. But in places where our approach on this has been, especially in places like rural communities where data suppressions can be an issue, having some data is better than no data. And our hope is, with all the contextualization around it, being able to provide a bigger picture narrative about how a community is doing based on estimates is better than having no visibility into what things might be looking like. But that is a great question. Okay, so the last piece, in our needs assessment, we would go through and say, just to sort of walk through big picture, I'm interested in a couple of social determinants: poverty, unemployment, income inequality. Those all tend to be pretty common starting places to look for. And then based on that, if you want to go the direction of health outcomes, you can do the same. If you want to look at educational outcomes, diving in, trying to build each story, downloading the relevant data or charts on an indicator by indicator basis to kind of support the narrative. Then the question is like, okay, where are things going? How do we take a step back again and say, big picture, what are the trends that we're looking at? So the other view, which is the community dashboard, the impact dashboard, this is all about kind of what are the latest estimates and where are things likely to go. And so we have, there's a number of different sections within this, but this community report is basically includes estimations around current work and employment, current poverty level, and then some projections around health and social determinants. So within the people tab, this is the overall demographic breakout. So we've got gender, population by race, change over time, and population growth, and then disabilities. The typical sort of demographic information most needs assessments need to include at the beginning. When we get to work and employment, and again, the maps are now, for those of you that have seen this, the new features are being able to go back and look at previous week's projections, as well as we now have the maps integrated into this report directly, which is cool. So it's the same 3D and 2D maps that you can see and print for each of the relevant indicators. So on the work and employment, the big question right now with COVID is how is this changing communities? There's the direct health impacts of COVID on infections and hospitalizations and mortality. But in most communities, the numbers have not yet been big enough, though we're getting close, where those have had significant impacts on things like overall mortality rate. So most of the impacts have been around employment. What we do on this one is we use unemployment claims data that comes out on a weekly basis to project out what the current unemployment rate is by sector, and then what the total unemployment rate likely is, what the long-term unemployment population is, and then that drives the poverty model. So within this report, we can see kind of where employment has typically been highest, but then shifting to how has unemployment increased since the beginning of the year. And here in Portland, we've seen the continuing claims number is about 3 times what it was at the beginning of the year. Though this is slowly getting better, as you can see, we're still at about 22,000 continuing claims for the city, with the estimate, which would translate into about 21,000 jobs which have been lost. and gives us an unemployment rate of about 7%, which is double the unemployment rate last year. So this is exactly the problem. If you were to rely just on ACS data to look at the social determinants and health within this community, one of the biggest social determinants is income and poverty. And we're already at double the rate that we were last year. But this is the latest estimate rather than the report value coming out of ACS. We'd also have a sector breakdown. This is what drives the model ultimately is the sector-specific employment characteristics. So within each city, there's a different breakdown of sector-level employment. Within Portland, healthcare is the largest employer with about 40,000 jobs. Education services and accommodation and food services are next. These top four are the top four for people who've been affected by the shutdowns and overall economic slowdown. So Portland actually has a higher unemployment rate now than we see in a lot of other communities because the industry employment is so weighted towards those sectors that have higher levels of unemployment specifically. So this actually changes pretty dynamically based on what the employment characteristics of your particular city look like. So we can see actually, because we know the employment characteristics down below the tract level, we can create the same hotspot map of where unemployment is likely to be worse today based on where the employment characteristics are. So we know for these two zip codes in North Portland, unemployment is going to be significantly higher than elsewhere in Portland, because they employ more people affected by these industries. So the other big part of this report is the unemployment scenarios, this dashboard. So we run a model, a couple of different models based on some different scenarios. The likely scenario, which we expect, some degree of continuing unemployment as we see COVID cases surge. But then after the beginning of the year, with slow access to a vaccine, we see things improving. So we return to an unemployment rate that is still elevated, but less than the peak that we would expect at the beginning of the year. The worst case scenario is a shock similar to what we saw in the spring, without really any recovery afterwards. So intentionally the worst case scenario. And then the best case scenario is no real peak coming up, maybe a slight one, but then things return very quickly back to close to where they were. Some institutional sort of damage because of the shutdowns, but generally unemployment returns to within a percentage point of where it was at the beginning of the year. So we think of these different scenarios as kind of guideposts, right? You can think of what does it look like when we're in the best case, what does it look like we're in the worst case, and what's likely to happen if nothing changes. And so within unemployment, we would expect in Portland, at least the unemployed population in 12 months to be slightly higher than where it is today. In the worst case, it would be almost triple where it is today. In the best case, it would be back to where it was pretty close at the beginning of the year. The next few tabs use that unemployment rate to drive through scenario planning for poverty. So we use what does long-term poverty look like, and we can see again sort of the poverty rate here in Portland, the visualization. How have things changed since the beginning of the year? We probably have about 12,000 new people in poverty. As we've been running these for the last couple of months, it's been really interesting. Back in August, the estimate was about double this. So we had almost 30,000 new people in poverty here in Portland. So as the unemployment claims have gotten better, the overall poverty projections have gotten better. The open question going forward is, they probably won't continue to get better at the same rate, given where we're headed on COVID, either just because people naturally are going to shy away from businesses, or where we see some sort of targeted shutdown over the next couple of months. So we expect this to go back up. The real question is going to be, what's the degree? Is it going to be somewhere around likely? Is it going to be worst case? Or where between likely and worst case is it? Is maybe the better question at this point. Again, you can look at previous weeks runs on this report. I think we'll capture 4 weeks back. So it can be a helpful thing to come back to. We use those poverty projections. Poverty in most communities is strongly correlated with health outcomes and social determinants. So we can use poverty, unemployment, and average income to feed into our multi-level, multivariate regression model and come up with some projections for what things might look like. These are not predictions, these are projections. And that's a very key point. We're not predicting any of these outcomes because obviously correlation does not equal causation, but within most communities, there is a strong correlative relationship that we can project around. So we provide some quality scores where we have high confidence around the projection and around the data quality. In some of these cases, we have less good data, but we still see a strong relationship. So we can say for a set of indicators, I think now we have heart disease, cancer, stroke, and I guess and suicide rate to capture some of the mental health outcomes. What the likely projections are under each of these different scenarios. And then the last tab is social determinants. And we've been working with a lot of different communities who are facing challenges around food and housing, especially as some of the more direct impacts of the economic challenges have been on people being able to feed themselves and pay for housing. We're not quite at the brink on housing yet, though we likely will get there in a lot of communities over the next couple of months as eviction restrictions are lifted. So we use a short-term model here to project out 12 months on food insecurity. Within Portland, for example, we would project under the likely scenario that food insecurity increases by 30% year over year. So still a big number. There'd be an additional 26,000 people in the population who are food insecure. And same story for housing insecurity. We'd see an additional 15,000 people under the likely scenario. In the worst case scenario, almost 90,000 people needing some sort of housing assistance. And in the best case scenario, we potentially actually reduce the number of people who need housing assistance. And then we capture high school graduation rate in the long term. This is, especially now where we're seeing such impacts on schools, being able to model what the long-term implications of poverty on high school graduation rate are. This is one of the strongest predictors of lifetime income. So we would see in the likely scenario, 1,300 people would not graduate who otherwise would. And in the best case, the worst case scenario would be 37,000 people who otherwise would graduate, would not graduate. Okay, so that's a lot. This presents a lot of information. And so the couple of use cases for this. On any of these charts and graphs, just like the maps, you can download them, include them in your report. It's a helpful way of sort of contextualizing where do you see the high, medium, low. What are the guideposts that we should be looking for going forward? It can also be a really helpful way of, because this model is run every week, using this more as sort of a monitor dashboard to be able to come back to say, okay, this is what we thought things would look like a month ago or a week ago. What do they actually look like today? Are we trending better? Or are we trending worse? And what are the implications for our strategic planning? So this is really, I think, a great tool to begin to norm people and move, especially where we're dealing with the situation on the ground changing on a day-by-day basis almost. Having more real up-to-date estimates of these key indicators like poverty and unemployment within a community can help organizations better be prepared and plan for what might happen in a month or 6 months or 12 months. And so being able to use this on that sort of recurring basis, weekly or monthly, because the data does change more frequently than what you see with the top line indicators, I think is a great strategy. Okay, that is a lot. So hopefully, just to go back to the slides here, we were able to answer some questions. How might you use DataContours to support your next needs assessment? There's a lot here. There's a lot of capabilities that if you've done needs assessments before, probably are new tools for your toolbox. If you're brand new, hopefully this sort of gave you a perspective on how you might approach assessing needs within your community. So we're here to help. Obviously, as we talked about today, we have these professional options for data available. We keep adding new data and new features. We also do training and technical assistance, similar to these webinars. But if you or your team are interested in chatting over analysis approaches, or if you have a particular question around, granularity or data availability, we're happy to set up some time to chat. We also do custom data and modeling needs. A lot of communities are looking at doing surveys or assessments to try and fill in some of the data gaps. So we have some good experience doing and collecting and analyzing that type of information. And then if you haven't, check out the free version of everything we've showed today. Again, you get the same features, just different, a little bit less data, but the link is here. So happy to answer any questions. Again, this was a lot of talking and a lot of stuff to throw. But if there's any questions about either high-level approach or some of the features or capabilities within DataContours, happy to answer. And we have a couple of questions. So do you have unemployment disaggregated by race? Great question. So it's one of the things we'll be releasing next week will be a couple of new data sets. We do have employment characteristics by age and race, and we will be releasing unemployment projections by gender and race. We'll also be releasing some income projections. As that is one of the big disparity questions around unemployment is how has it been affecting minority communities or vulnerable populations. So that'll be coming next week. We're really excited to get that out the door. There's some really interesting stuff there. Then other question from April is, are communities considering demographic changes? If we don't work to reduce racial disparities, this could have a huge impact on poverty later. Yeah, I mean, this is one of the big challenges that we're all wrestling with. I think every community is struggling to figure out both what's the appropriate way to look at racial disparities and issues like gentrification within their communities, and what to do about that. I know here in Portland, there's a lot of conversation around housing and what's the right way of mixing housing so that we ensure we don't, price people out of living where they want to and end up with less diverse communities because of it. So I think this is a hot topic, and there are lots of different ways of looking at this. And it's certainly something that we've been thinking a lot about. How can we support this maybe through a couple of more specific analysis tools? We do have something in the works around equity and disparity in populations. So we're thinking actively about this. All right. Any other questions? If you are a current user too, happy to answer. Oh, I did want to. There was one other thing. New too. There's this little help button down here. I've had a lot of questions about indicators. So you can now type in the indicator that you're interested in, and we're adding in the definitions and sourcing for each of these indicators. So this will show up right here, and you can link to the source. So for those of you that have raised this, I'm happy to put this out there, and hopefully this will start to make it a little more clear where the source data is, where it's coming from. All right, any other questions or thoughts? Okay, well, you all hopefully know where to find me or us if you have questions. You'll get some follow-on information via email, again, link to the slides and the webinar thing. But if you do have any questions or thoughts or interest in DataContours, feel free to reach out. And hopefully we'll talk to you all soon. Take care.